I remember back when I was taking sex ed and all these different science classes, one thing that I thought didn't get enough attention were urinary tract infections. Between 50 and 60% of US women will have at least one urinary tract infection in their lifetime. Not to mention there's a huge disparity in terms of what people know about urinary tract infections. Some people know a lot and other people don't know much at all. So today we're going to talk about the pathophysiology, or what causes a urinary tract infection and why they're more common in women. An uncomplicated urinary tract infection is simply a bacterial infection of the urinary tract or bladder, and typically presents with fever, pain with urination, and abdominal pain. Females are considered to be more predisposed to urinary tract infections for several reasons. First of all, the female urethra is much shorter than the male urethra. I wish I could show a good picture, but unfortunately TikTok likes to take down these kind of things. On average, the female urethra is about 1.5 inches long. On the other hand, the average male urethra is several inches longer. Shorter urethras actually make it easier for the bacteria to ascend, because that's where these infections come from. They come from the opening of the urethra, and then they ascend upwards and into the bladder, and then from there they can even cause further complications if they ascend up the ureters and infect the kidneys. But anyway, the shorter urethras are more prone to infections than longer urethras. Also, if you just take a second and visualize the female anatomy, you can understand that the female urethra is much more exposed to the external environment than the male urethra. Furthermore, its proximity to the vaginal canal makes it very easy to introduce foreign pathogens like bacteria into the urethral environment. Another thing to keep in mind is that enteric bacteria that lives within our digestive system, especially our colon, loves to cause UTIs. This is actually why they say when you're going to the bathroom that you should be wiping from front to back instead of back to front, because you don't want to bring that material closer to your urethra, because you can be introducing bacteria that can potentially cause urinary tract infections. If we look at this very rudimentary drawing of the male anatomy, and TikTok, please don't take this down, we see that the scrotum can actually act as a natural barrier between the anus and the male genitals in the urinary tract. This makes males slightly less prone to urinary tract infections. If we understand this, then we can also understand why it's important to engage in some form of hygienic practice when switching between anal and vaginal sex. The last thing that we should note is that urination actually flushes out bacteria from the urinary tract. In other words, there is some merit to peeing after sex, because this can help flush out any bacteria causing infection. Hope you learned something.